Congratulations. Congratulations. For student, you are entering into a new phase of life. I have spent whole of my life in healthcare as a surgeon, as a teacher, as an administrator. Two things are glaring, very glaring in Pakistan in health system. One is a access to care and other is a care at the bedside. So you have chosen a field which is a need of the hour. So I always say, I have said this in policy making meetings everywhere, if you want to improve healthcare in Pakistan, improve family medicine and nursing. So that underscore how important the nurses are. Unfortunately, this profession has not been given respect and status which it deserves. So purpose of this school is to give these young men and women who are entering into profession experience, so that when they leave this college, they are ambassador of this college and they don't think that they are not less than anyone on this planet. Okay? So about few words about education. That's my passion. So education is changing altogether, and recently during COVID pandemic you have seen how it has changed from classroom to online, which I think is not a good shift. So you don't know what student is doing while attending the lecture which you are giving and which you have prepared after a lot of hard work. But certainly new ways of teaching are around the corner and they will be in place, and you are lucky that you will experience some of those teaching method which will make you a good nurse. So I end up here, and before ending I would really thank the family which thought about establishing this institution. I spent my whole life in Karachi, almost all life in Karachi. My first interview with this organization, two things attracted me. One was a Spring Institute. I said a hospital which can think about mental health is worth joining. And second, when the chairman and met me in an interview, what he persistently talked about two things. One is equality and other is we need to make it a teaching institution. So that's how it will happen. Nursing college is a beginning, and you will soon will be getting your fellow student in medicine and allied health sciences, which complete the spectrum of frontline workers in healthcare. So our idea is to have a integrated medical education. That's why I always, when I met Lubna, I talk about it. There is a long gap between the nursing service and education. And she has experienced it, and I have experienced as an administrator in one of the best hospital in the country. So the both service and the college should talk to each other and work with each other to make it possible to have a best product from the college. So that's where I would end. I would again congratulate the students and parents to have started a new journey in life. Thank you.